especially because there is so much chatter, if you will, about the age of President Biden. He's 79, that they are transparent, and that if they say he's doing well, they show him doing well. And in the event that, God forbid, that the president is not doing well, that they are transparent about that as well. But again, I think we've heard from his doctor, Dr. O'Connor, and you'll hear again during the White House press briefing that they believe the prospects for the president are great, and he's doing well, and they're going to continue to monitor him. So I think the White House did what they were supposed to do this morning, and I feel informed. I don't know about you.
Yeah, I'm with you on that. Simone Sanders from MSNBC. Simone, we appreciate your time and perspective on that today. Thank you. Now, we do want to note the president's most recent official health exam was back in November, and back then the White House doctor reported that he was in very good health. He did have a single benign polyp removed from his colon, we understand. The doctor also reported he'd been dealing with acid reflux more often and was walking more stiffly because of wear and tear on his spine, but in remarkable health for a man of his age. I want to bring in NBC News medical fellow Dr. Ashish Jha now to talk a little bit more about this, a part of our NBC News medical unit and a practicing physician, I should know for our viewers. I want to ask you first, we played this video of the president standing on the White House balcony. You've treated other folks his age who've dealt with COVID in the same sort of circumstances as him. Just your thoughts, your impressions after seeing that video.
Yeah, I mean, Aaron, I agree with you. He looks like, President Biden on any other Thursday. And I think, one thing I've learned is you can tell a lot about a patient by how they're acting, right? Are they making jokes? Are they laughing? Are they eating? Are they walking around? And, he's not in bed. He's not lying there sick. He's not tired, at least from what we can tell. So, we'll learn more at the briefing, but from all indications so far, he looks pretty good.
And we should note that briefing will be happening, we expect, in the next couple of minutes here. We noted that the president is fully vaccinated. He's been boosted twice. This is actually a part of the letter that we got from the White House, from the president's doctor, Dr. Kevin O'Connor. I think we can put part of it up on the screen here, saying that the president's fully vaccinated, twice boosted. So I anticipate that he will respond favorably, as most maximally protected patients do. Early use of Paxlovid, in this case, provides additional protection against severe disease. So I'm going to ask you, Doc, to explain to our viewers how Paxlovid works. I took it when I had COVID. Help us understand what it is, how it works, what side effects there may be.
Yeah, so as Peter said, Paxlovid is what we call an antiviral. And the easiest way to put this simply is it blocks the virus from replicating. All viruses, when they get inside you, they want to keep reproducing and replicating to make more of them. And so what Paxlovid does is when you take it early on enough, it actually reduces the amount of virus in your body. Pfizer says up to 10 times compared to people who don't take it. And, with everything in medicine, sometimes, patients ask, what are the side effects, right? Because virtually every drug we prescribe, there's always some side effects. And the big one to note is really an altered sense of taste.
It was awful. The worst.
And so, what I tell my patients is if you take this pill and you get home and all of a sudden, you can't even swallow your own cooking, right? It's not your cooking. It's part of the medication. It's part of the pill. It will go away after the treatment.
Now, we've also noted that the president is 79 years old, right? He's an older man, and he's had some mild symptoms, as we understand at this point. What concerns would you have, and having treated patients of his age with other health issues, what concerns would you have at this point about potentially any long-term impacts from having had COVID?
Yeah, so I think the big one everyone's thinking about really is long COVID, right? Is he going to have prolonged symptoms after he's recovered? And so what we know is, he's twice boosted, like they've said. So we know from early data that people who've been vaccinated do have a lower risk of long COVID. Dr. Fauci even believes that, taking this antiviral, the Paxlovid, can even reduce your risk further. So, every time somebody gets infected with the virus, we are in the back of our minds thinking about long COVID. We're optimistic that won't be the case here.
How surprising is it for you? I mean, if you sort of set aside all the protocols that are around the president of the United States with testing and trying to make sure he's kept as safe as possible, to be 2 years plus into this pandemic, and he's just now for the first time getting COVID, especially now with BA5 and all these other things around, how surprising is it for you that it took this long? And is this something that just sort of is something that we should expect, not just for him, but for the rest of us?
Yeah, I mean, to be honest with you, it's not that surprising. I mean, the amount of people I know who haven't had COVID, I can probably count on one hand.
Right.
And so it's not surprising. It's definitely something we should expect, especially as these more contagious variants come out. The good news is we are in a completely different landscape than we were the last time a president tested positive, right? We have vaccines, we have therapeutics. So although it may be more common, we do have the tools available to fight it.
And part of that, we heard the First Lady talk about wearing a mask. Obviously, she's a close contact of the president. So for her and for any of us who've been close contacts of people who currently have COVID or had it or will have it. What do you suggest? What's your recommendation for how we move forward with living our lives once we've become a close contact?
Yeah, I think we're still in the part where people who are close contacts, the CDC says this, right? If you're a close contact, keep your mask on for 10 days, right? There's still a chance you could have the virus and still spread the virus, even if you don't have symptoms, right? I think by now most of us know this. So for close contacts, I think the 10-day mark is really where it's at right now.
And then wear a mask. The good mask, the ones that'll really work for you, right?
Yeah, I think with these transmissible variants, the good masks, not the cloth masks anymore.
All right. We do want to note for our viewers, and Doctor, you're going to stay with us here. Well, we're expecting the White House press briefing to begin. We're still monitoring that, watching the podium there. We're going to hear from the White House press secretary, Karine, Pierre, as well as Dr. Ashish Jha, the COVID response coordinator, not only about, we expect, the president's condition, but I would imagine that we're also going to hear largely about the pandemic in general. Obviously, what's going to be happening in the White House as a result of this diagnosis of the president, but also this will be, I would imagine, Dr. Sayal, an opportunity for Dr. Jha to come out and talk about the pandemic more broadly and how the rest of us need to continue thinking about this. There's been so many people who have thought, okay, well, we're post-pandemic now. And the reality is, we're still very much in a pandemic. It is not over. It's not going away likely anytime soon, right?
Right. And, these case counts we're seeing every day, I mean, we're all taking home tests now, and these home tests aren't really getting registered in the case count. So we really don't have a good sense about how much virus there is right now, just that there is, unfortunately, a lot still out there.
And again, we already see, as we look at the live picture here from the White House briefing room, several of the correspondents who are part of the press corps there standing by to do some reporting as we've gotten a warning that this briefing should begin at any moment now. And of course, as soon as it does begin, we'll be taking you to an NBC News special report so that you can hear directly from the people who are most involved with the operation of the White House and the care of the president about what's going to be happening in the days to come. A lot of the guidance that some of the regular folks have been hearing, Dr. Sayal, as of late, is that if you go a certain number of days without real symptoms, then you're probably okay to sort of rejoin the working world or whatever your normal activities might be. Is that still the advice that holds in most cases, that we might expect to see the president, if he's symptom-free, back out at work in the very near future?
Yeah, that is. And I would take that a step further, right? I would say with all the at-home tests available, if you're at the point where you're looking to rejoin society, take a rapid test, take an at-home test. There are really good markers to see, quote, like, am I contagious? Mm-hmm. And that's a really important thing if you're looking to join society, to know whether or not you're contagious. Talk
about that a little bit. I think at one point I heard or maybe read one of your pieces on NBCnews.com about the PCR test versus the rapid tests and what tells you what when in the process, that the rapid test may be more useful in understanding that you're contagious at that point versus PCR. Help us understand that a little bit.
Yeah, so basically the rapid test it takes more virus in your nose to turn positive on a rapid test. The more virus you have, the more contagious you are, theoretically. Mm-hmm. So if you take an at-home rapid test and you're positive, there's a really good chance that you are capable of spreading the virus. PCR tests can actually stay positive up to 12 weeks after you've been infected. So even if you're past the isolation, the quarantine, and you're testing positive on PCR, it doesn't necessarily mean you can spread the virus.
All right. I want to bring in Vaughn Hilliard, who's also monitoring the situation for us today in our newsroom, gathering some information as well. Vaughn, I just want to reset for our viewers who may be just tuning in with us here what we know about the president having tested positive this morning.
Right. We've been waiting for this update to come from the White House. We were expecting it here at the top of the hour. Of course, it's been delayed. And if you contrast this response from this White House compared to the last White House when President Trump ultimately made his way to Walter Reed, this White House has said that they will give routine updates about the health and the condition of President Biden. And I think that's why it's important that you see that video that comes out there. What we know so far and what we expect to get further details on from this hearing is the exact symptoms that the president is.
This is an NBC News special report. Here's Lester Holt. Good day, everyone. We're coming on the air with breaking news. Just moments from now, we expect a briefing from the White House updating us on President Biden's condition after it was announced this morning that he tested positive for COVID. White House Press Secretary Karine Jean-Pierre will be joined by the White House COVID response coordinator, Dr. Ashish Jha. In just a few minutes ago, President Biden sent out a taped message from the White House where he is working in isolation.
Hey folks, guess you heard this morning I tested positive for COVID, but I've been double vaccinated, double boosted. Symptoms are mild, and I really appreciate your inquiries and your concerns. But I'm doing well. I'm getting a lot of work done. Going to continue to get it done, and in the meantime, thanks for your concern and keep the faith. It's going to be okay.
The president putting that out just a short time ago. As he said, his symptoms are mild, including fatigue, runny nose, and a slight dry cough, familiar to anyone who has had COVID or knows someone that has had it. The president is taking the antiviral medication Paxlovid, and his age, 79 years old, is a concern for any COVID patient. First Lady Joe Biden has tested negative and traveled to several events today and will head to Delaware tomorrow. As we await the briefings start, let's go right to Chief White House correspondent Peter Alexander inside that briefing room. Peter?
Lester, we expect to hear from Dr. Ashish Jha just moments from now as he is expected to enter the briefing room alongside the press secretary Karine Jean-Pierre. One thing I'll note is that the White House says that the president will remain in isolation for as long as he is testing positive. So not until he tests negative for whatever period of that time before he will leave isolation. He was scheduled to travel today to Pennsylvania. That was canceled. Then to Wilmington, Delaware. He's not going there either. In fact, his wife, the First Lady, will spend the next several days, we believe. She arrives in Wilmington later today after conducting her schedule as planned. As a close contact, she will be wearing a mask and will be socially distancing. The president has had a limited schedule over the course of the last several days since returning to the U.S. from Saudi Arabia. He went to church on Sunday, met with the First Lady to Ukraine, Olena Zelensky, on Tuesday. They were photographed indoors together without a mask. And here comes Karine Jean-Pierre.
Good afternoon, everybody. As you all know, I received a letter from the president's personal physician this morning. We released it to you shortly thereafter in the interest of transparency. I have the letter here, and I just want to read it through so we can get started. Before we get started. This morning, as part of our routine screening program for the president, the SARS-CoV-2 virus was detected by antigen testing. This result was subsequently confirmed by a PCR test. On questioning, President Biden is currently experiencing mild symptoms, mostly a runny nose and fatigue, with an occasional dry cough, which started yesterday evening. Given that he meets USA Food and Drug Administration, FDA, Emergency Use Authority criteria for Paxlovid, I have recommended initiating such treatment. The president is fully vaccinated and twice boosted, so I anticipate that he will respond favorably as most maximally protected patients do. Early use of Paxlovid in this case provides additional protection against severe disease. He will isolate in accordance with CDC recommendations. I will keep your office updated with any changes in his condition or treatment plan. I also wanted to provide you with a brief readout of the president's activities today. The president has been working from the residence, like so many of us have during this pandemic, doing calls with senior staff, including the chief of staff, myself, and Dr. Jha, who's here with us. As we read out, the president also called Senator Casey, Representative Cartwright, mayors of Scranton, Mayor of Wilkesboro, and Representative Clyburn. The president also called a few of his cousins from Scranton who were set to attend today's event in Pennsylvania. And he spoke with Ambassador Giddenstein and Cornyn. You all have seen the photo he posted on and the video that was just released to all of you out of transparency moments ago. The president will continue to work from the residence. Today, as you all know, as I just mentioned, and as we sent out earlier, Dr. Ashish Jha, our COVID-19 response coordinator, is joining joining us today in the briefing room. And as I tweeted out earlier, Dr. Jha and I spoke to the president this morning, and he said he's feeling fine. He has a little dry cough, as I just mentioned from the doctor's letter, a little runny nose. He's feeling tired, but he's working very hard on behalf of the American people. And with that, Dr. Jha.
Good afternoon, everybody. I'm pleased to be with you. As Karine mentioned, I spoke to the president earlier. I also spoke at length with Dr. O'Connor, who is the president's personal physician. And I'm happy to share the readout of these conversations with you, and then I'm happy to take questions. In terms of my conversation with the president, he sounded great. I asked him, Mr. President, how are you feeling? He said, I'm feeling fine. He said he was feeling fine. He had been working all morning. He hadn't even been able to finish his breakfast because he had just been busy. I encouraged him to finish his breakfast. In terms of my conversation with Dr. O'Connor, we talked at length about what happened this morning. As Karine mentioned, the president got his regular testing that he does on his regular cadence. After he tested positive, he reported these symptoms that have been described. Dr. O'Connor examined him thoroughly. He found his exam to be normal, to be at his baseline. And then obviously he recommended that the president take Paxlovid. The president accepted that recommendation and has started Paxlovid and has taken his first course already. I want to also just take a minute to sort of mark this moment. Because the president is fully vaccinated, double boosted, his risk of serious illness is dramatically lower. He's also getting treated with a very powerful antiviral, and that further reduces his risk of serious illness. And it's a reminder of the reason that we all work so hard to make sure that every American has the same level of protection that the president has, that every American has the same level of immunity, and why we have worked so hard to make sure that people have access to life-saving treatments like Paxlovid. These are incredibly important things for the president to have. They're incredibly important things for every American to have. And we have worked very hard over the last 18 months to make sure we have plenty of vaccines, that we have plenty of therapies, that people can get tested on a regular basis, as the president does, because testing allows you to identify an infection early and get started with treatment early. And we all know from medicine that early treatment is always better. Let me also take a moment to talk about BA.5. If you've listened to me at all in the last couple of weeks, you heard me talk a lot about this subvariant of Omicron that is now 70-80% of all infections in the United States. It's a reminder to everyone, if you are over 50, the way I am, the way many of you might be, if you are over the age of 50 and if you've not gotten a vaccine shot in the year 2022, you need to go get one. You need to go get one now, because it will dramatically improve your level of protection, reduce your risk of having serious illness. It's the best thing that people can be doing. Let me just finish by saying, obviously we work hard to protect the president, make sure he's been vaccinated and boosted, has access to treatments. We also have been working very, very hard to make sure every American has access to the same things. Because every American deserves access to the best vaccines, the best treatments, and they are widely available. And I want to use this moment to remind everybody of that and to remind everybody to avail themselves of that. Get vaccinated. If you have a breakthrough infection, get treated. It's the best thing you can do to protect yourself. Let me stop and take questions, and I know you will as well.
We'll both take questions, but go ahead, Nancy.
Thank you so much, Dr. Jha. Has the president been tested to determine which variant he has? Is it BA.5? And if so, what does that say about his prognosis?
It's a great question. The virus has been sent off for sequencing. It takes usually about a week for that sequencing to come back. That's under normal circumstances. He's the president. The sequencing will get prioritized. So we should have an answer sooner than that. But you can't just tell from a regular test what kind of variant. So the sequencing results will be back at some point less than a week from now.
And has the president had to halt any of his regular medications now that he's taking Paxlovid, and what are you doing to mitigate the risk from halting those medications?
Yeah, so I had a conversation about this with Dr. O'Connor. There are two medicines he's on, Eliquis and Crestor, cholesterol-lowering medicine, and a blood thinner for his atrial fibrillation, both of which need to be stopped when you take Paxlovid. It's a very standard, common thing that we do when we give people Paxlovid, and you don't need to do anything in those circumstances. They both get stopped for the 5 days that he's on Paxlovid, and then they get restarted, and it's totally fine and pretty normal practice.
Okay. Where exactly was the president infected?
Where was he infected? I don't think we know. I certainly don't know if you have any thoughts on it.
Look, I don't think that matters, right? I think what matters is we prepared for this moment. I think what matters is what Dr. Jha just laid out. If we look at where we were a year and a half ago, this is a president, when he walked in, one of his first priorities was to make sure we had a comprehensive plan to get people vaccinated. And so now today, look to today, more and more people are getting closer to having a more normal life. Vaccines are available, and as Dr. Jha said, if you have not gotten vaccinated, please do. If you have not gotten boosted, please do. These are treatments that are going to keep you safe, and I think that's what matters here, is making sure that we continue to do the work. And the good thing is that the president again has been vaccinated and double boosted. Okay.
We know that rebound COVID cases have been a concern in some individuals who take Paxlovid. Are there any precautions you can take to try and prevent that, and how concerned are you that that could potentially hinder his return to the office?
It's a great question. So let me tell you what we know about rebound. So we've looked at the clinical data on this, because if you look at Twitter, it feels like everybody has rebound, but it turns out there's actually clinical data. If you look at major health systems that have given out Paxlovid to tens of thousands of people, rebound rates are around 5%. There are some studies that suggest maybe 7-8%, some that say it's 2%, but it's in the single digits. So it happens, it's not that frequent. But here's the key point about rebound, which is when people have rebound, they don't end up in the hospital, they don't end up particularly sick. And the goal of Paxlovid is to keep people from getting seriously ill. And so it continues to work. His physician is in charge of taking care of him. Obviously, the president will continue to be monitored, as he is, but the Paxlovid is working really well at preventing serious illness, rebound or no rebound, and that's why he was offered it, and that's why the president took it.
And you mentioned the symptoms that the president has had so far: runny nose, fatigue, dry cough. What other symptoms are you looking out for at this point? Obviously, this is the beginning of this, and what would warrant hospitalization?
So right now he feels really well. Our expectation is that he's going to continue to have mild illness, and he's going to be monitored for symptoms. I mean, you ask him, kind of every day. I asked him, how is he feeling? Is he having any other symptoms? He's not. And I think we're going to continue monitoring that, and I don't I think that is the plan right now, is that he's going to get care the way he would. I was going to say the way he would any other person. He's the president, so obviously he gets extra attention, but I don't think we have any expectations of any other symptoms at this point.
I'm going to go to the back. Go ahead, April.
Come back. I want to follow up on that on a couple of questions. So if the president's oxygen level went down, would he be a candidate to go to the hospital?
At this point, we don't generally want to avoid hypotheticals. He is breathing well, his oxygen level is normal, and he's, I was going to say resting comfortably. He's actually not resting comfortably. He's working comfortably in his residence.
But that's not a hypothetical in COVID, sir. And the next question, in this moment, we understand that the incubation of COVID is 2 to 14 days. Has the White House reached out to those the president has been in contact with, in-person contact with, in that period of time?
So CDC has very clear protocols on this in terms of when people are contagious pre-symptoms. The White House Medical Unit is conducting right now a contact tracing, and they are contacting every single person who meets the CDC definition of a potentially close contact.
And speaking of the CDC, this last question, the CDC says if you are in a high-risk area, and a large swath of the nation is in a high-risk area, they recommend wearing masks indoors. In this White House, we're still seeing people back and forth. DC is is in that high category. Is there now a push to tell people to start wearing the masks indoors, especially as the president now we see has COVID?
I actually, off the top of my head, can't remember where DC is on the orange, yellow, green map. So I'm not going to kind of do this off. But the bottom line is we follow CDC guidelines, and the policy at the White House is to follow CDC guidelines in terms of mask wearing based on CDC's COVID community levels.
Go ahead, Ashley.
Thank you. Will the president resume public events in 5 days if he tests negative, or will the White House be more cautious and have him isolate for 10 days?
So the plan right now is to follow, it's actually, we do CDC guidelines, but we actually go beyond CDC guidelines. So he's certainly going to isolate for at least 5 days, and he will return to normal activities after he's had a negative test.
And I'm also curious, what precautions, we saw that video the president put out, what precautions did you take for the person who filmed the video?
Yeah, I just want to touch on a couple of things. So, look, right now we heard from the doctor, Dr. O'Connor, his personal doctor, and he has mild symptoms, and he's continuing to continue to do the work of the presidency from his residence, and I think that's important. And and to your question, April, every person reacts to COVID differently. So it is a hypothetical, right? We're going to keep an eye. The doctor is going to keep an eye on him. I think what's important, though, and I really want to take this opportunity to say this, and Dr. Jha said this as well, is that he is vaccinated and he is double boosted, which gives him protection, right? Which makes it puts him in a good position, just like every other American that he fought so very hard for, to make sure that we had a comprehensive COVID plan to get people vaccinated, boosted, and also Paxlovid, right? And so what we need to know is he has mild symptoms, and he is going to continue to do his work, as we've seen from the video. Ashley, I'm going to take your question right now. Look, in the video that you saw, there was his videographer was there with him, wore an N95 mask, had the appropriate distance, the 6 feet distance, in the same situation as well with the photo. And as you saw in the video, he was outside, so we did that outside. And with the photo, he took off his mask so that the American people could see him and see directly, see the work that he's doing, and that he's sitting at his desk continuing to do his work. But just wanted to give that. Go ahead, Dr. Jha. I don't know if there's
Go ahead. Can I ask whether there was any consideration given to other treatments other than Paxlovid, such as a monoclonal? It's been unclear how the two work together. If it's more serious cases that get a monoclonal, can you walk through that?
I think there are two good choices for therapies.
One or the other.
I think there are two good choices. There are people who get both. I think this was a decision made by Dr. O'Connor in consultation with certainly the president, the patient, and I also know that Dr. O'Connor spoke with infectious disease experts at Walter Reed and at George Washington University. That was all part of the plan, by the way. We'd always sort of planned that if the president got infected, we would consult with experts. He did, and based on that, that was a recommendation that Dr. O'Connor made. And the president accepted that recommendation.
Would that be an option if the case were to worsen? If someone who gets Paxlovid, things get worse, can they get a second?
In terms of his clinical care, first of all, Dr. O'Connor is going to drive that process with consultation from experts, not just at those institutions, really around the country. And I think he's going to make decisions based on what is happening with the president in his condition. Right now, the president's feeling well. He described it himself as feeling fine with mild symptoms.
And we've seen with rebound cases, second courses of Paxlovid. Would the president, if he had a rebound case, in other words, tested positive after testing negative, get a second course of Paxlovid?
A lot of hypotheticals there of lots of things that might happen down the road.
That's not what Dr. Fauci is.
I understand. No, it is, but it's hypothetical. The president feels fine right now. I don't think, I think we will cross that bridge if that happens, but at this point, really focus on just making sure the president continues to do well.
And I'm sorry, just very, very quickly, just to clear the timeline, he popped on a routine screening test and then spoke to doctors about his symptoms, as opposed to saying, hey, I have symptoms, let's do a test. That's the order of things.
He was scheduled to get his test this morning. It came back positive. And on questioning, as I understand it from Dr. O'Connor, on questioning, reported that, yes, he was having these mild symptoms.
And just to add, you guys saw him yesterday. He was in Massachusetts, Somerset. He spoke for 20 minutes in 93-degree weather. It was incredibly hot. He was feeling fine, you know, where most of us were looking for water and trying not to pass out. The president was delivering remarks on a very important issue on climate change, as you all saw. I do want to add just that as we've stated, Dr. O'Connor, you all will hear, get daily updates from Dr. O'Connor and how he's doing. So I just wanted to add that, and we'll just continue to. Okay.
A couple simple questions, if I can. First of all, was the president ever identified as a close contact to anybody else in the course of the last 72 to 100 hours, say?
Not that I know of. Do you?
Well, I'll say this: the process is we are starting our process our protocol process on close contact.
Was he ever identified as a close contact to somebody else, though?
Oh, to someone else? That part we would have to find out. I can't speak to. What I can say is our process, because as we all stated, he is now positive. We are doing our process for our close contact component.
How many people have been identified as close contacts to him without detailing
We are just
specifics?
starting our process, so I don't.
To this point, how many have been?
I'm just saying we're just starting our process. I don't have a number to read out to you. I told you that he called the members, the congressional members that traveled with him yesterday, but we're just starting out our process right now.
Has anyone else at the White House tested positive this week?
Well, as we normally do, if they are a close contact to the president, we normally provide that information. When I tested positive and I was a close contact out of abundance of caution, actually, I was not. But because I had traveled with him, we share that information. But we have a protocol here that we will continue to follow when it comes to who's a close contact to the president, and making sure that we make that clear. And in December of last year, when he was traveling and there was someone who was a close contact to him, we shared that as well. So we've been transparent on that.
In simple terms, is anybody else in the West Wing or at the White House positive now?
Right now, all I can tell you, if they are, our protocol is, if they are a close contact with any of the principals, we share that information.
You can't say beyond that. Let me ask Dr. Jha one final question, if I can. We saw the president's video, and I understand the desire of the White House to show the president 6 feet away. The individual shooting it was wearing a mask. But for regular Americans who are watching this right now, what would your recommendation be? Should Americans who are positive for COVID, if they are in public or in any place at any time, always wear a mask?
So the CDC guidance on this is clear. People should isolate, and they should, if they're going to be in close contact with anybody else, they should definitely be wearing a mask. The president was more than 6 feet away from the camera person, who was wearing an N95. Again, in that video, you saw that it was outside. So I think it was, from a safety point of view, a very safe thing to do.
Thank you, Dr. If I can ask the last question of Dr. Jha.
I'm going to call in everybody. I promise. I'm going to call in everybody. Go ahead.
Thanks, Karine. Can you explain the testing cadence and the rationale behind it? Given the rise of BA.5 and the fact that the president's been traveling and having big events, why doesn't he get a daily test?
So the testing cadence is determined by Dr. O'Connor, his personal physician. He gets tested very regularly. I don't really think there's a huge advantage of testing like every day. I think.
Had he tested yesterday morning, for example, he might have tested positive in time to not go to that trip and expose any number of people, right?
The president, the protocol behind the president's testing has been both developed by Dr. O'Connor, but I think also has gone through a lot of vetting. It's what we use to protect the president and those around him, and it's been. I don't have anything else to say beyond the kind of the protocol we have.
Look, like Dr. Jha said, it is between him and his personal doctor on that protocol. He has a regular cadence, as we have spoken about before. We shared with all of you on Tuesday that he tested negative, and the reason why you saw him yesterday, I just said, he was speaking in front of many of your colleagues outside for 20 minutes on a very, very hot day, and it wasn't until later in the day, in the evening, that he was feeling a little tired, and he was tested today. Look, this goes back to where we have come from, where we started. The president has done the work to make sure that more than 200 million people in this country have been vaccinated. More than 100 million people in this country have been boosted. That's because we have a comprehensive plan to make sure people get vaccinated so that they can be protected. And so that is what's most important here. He has mild symptoms. He continues to work. And like many Americans, this is, we have to make sure that we send out message to make sure to get vaccinated and boosted if you haven't yet.
Does the president, does the White House, are there any regrets about the amount of time in sort of recent days and past weeks that we've seen him unmasked, shaking hands with people, hugging people, fist bumping, in close contact with crowds? In retrospect, was he too casual?
No. I mean, look, I look at this, I've said this before from this podium, we have an incredibly contagious variant, and we've had a protocol that I think has done a very good job protecting the president. The most important part of that protocol, by the way, is making sure that he was up to date on his vaccines and we had access to treatments. The president wants to get out there and be with and meet American people and engage, and we always said that this was a possibility. I think I even said it from this stage that this was a possibility. I think that the protocols have kept him from getting infected, but we knew that this was a possibility with this incredibly contagious variant. The good news is, and this was always the point, the good news is his immune system is very well protected given the 4 vaccine shots he's gotten. He's getting treatment. He has mild symptoms. He's feeling fine, his words.
Go ahead, Jeff.
Dr. Jha, if I could please ask you about the president's age. He's 79 years old. What level of concerns does that add when someone like him tests positive?
Very simply, I would begin with what's his immune status and what are his access to treatments, and the bottom line is, given how much immunity he has from vaccines, given that he was started on treatments right away, like literally at Symptoms this morning, got started on Paxlovid this morning, I think all of those things very dramatically reduce his risk of serious illness. And that's really the goal here, is to prevent serious illness, to keep that risk as low as possible. I think he's gotten that full set of protections.
And in terms of monitoring his oxygen, is that something that will be done hourly, something that will be done a couple times a day? Just walk us through, if you could, the oxygen levels and the concern that could raise.
Yeah. I don't actually know how often. What I will say is that he's monitored very regularly. He's feeling well. His oxygen level was checked this morning. It was normal. And the exact sort of frequency of that is a decision between him and his physician, and really Dr. O'Connor making that call.
You said it doesn't matter where he got it, but how can it not matter where he got it if that is something that, of course, is involved in contact tracing? This administration is taking it very seriously. How can it not matter?
I think what I was trying to say is what's important now is that he has mild symptoms, is that he is working from the residence on behalf of the American people. That's our focus. Look, we knew this was going to happen. As Dr. Jha said, when he joined me at the briefing in the briefing room not too long ago, he said this is everyone was at some point everyone's going to get COVID. What is important is to make sure that you get the treatment that we have provided for folks. Whether it's make sure you get vaccinated, make sure you get boosted, and then we have Paxlovid that is made available because of this president. So what I'm trying to say is the moment that we're in right now is what matters as we're talking about the president and his treatment and how he's feeling and how he's continuing to work on behalf of the American public. I'm going to move around because I know there's a lot of Dolan. Go ahead.
Thank you. Karine, you said that he was feeling fine yesterday during his speech, but that he started to feel tired later on in the evening. I just want to clarify. Can you say exactly when he started feeling mild symptoms?
I cannot say exactly when that occurred. I could say that he told us this morning he had a runny nose, he had a dry cough, He was a little bit fatigued. He did say he had restless sleep, and when that occurred, he got the antigen test, tested positive, and then was given a PCR test. I cannot pinpoint the exact moment, and we were transparent. I got the letter from. We put out a statement as soon as we did the test and were able to put out the information. So we were transparent in giving out the statement. We were transparent in sending out the letter, and we will have daily updates from his doctor on his status.
In terms of the search for close contacts, I understand that's underway now, but there should still be able to be some confirmation of at least some individuals who were in close contact. He was with multiple members yesterday on Air Force One. He was with the First Lady of Ukraine as well on Tuesday. Can you tell us if the Vice President is a close contact, if those members that were on the plane are considered close contacts?
Yes. So when it comes to the Vice President, she spoke to this earlier today. She just gave comments and she spoke with the President. I will let her speak to that. You heard from the First Lady. Of course, she's the First Lady, and so she spoke. She said she tested negative, and clearly she is a close contact. Look, I'll say this. Our commitment since last July is to disclose when the President or one of the 4 principals is a close contact of staff who tested positive as defined by the CDC. This is a definition by the CDC, or when he tests positive, which is what we're doing to all of our review today. So, for example, we were transparent with the Vice President. We were when she tested positive, when the second gentleman tested positive, and we're doing that currently right now with him. So we are transparent when the President Biden was a close contact of a staff member, as I mentioned in December, but for privacy reasons, we will not get into more details as it relates to that. So we're starting the process. I don't have a number, a list of folks to share with you. I think that if I know some of your colleagues traveled with us, if there are any concerns or questions, feel free to reach out to us. We're happy to, if you have personal questions about yourself, feel free to reach out.
I have one more. Just Ashley asked as well, I think, about moving forward the 5-day quarantine, whether or not he would immediately resume. I believe you said that he would quarantine for 5 days and then he would resume when he tests negative, but I just want the connective tissue here. If he tests negative on that 5th day, would he resume his schedule as normal?
Yeah, so the CDC's guidance on this is very clear. You have to isolate for 5 days. CDC says that you can resume after 5 days without a negative test, as long as you wear a well-fitting mask. We go above and beyond that at the White House, and the President will get tested. And as long as he's isolated for 5 days, meeting the kind of CDC requirement, we will wait until he gets a negative antigen test, before he returns to activity.
Go ahead, Steve.
How does the White House adjust having a president with COVID? Who has access to him? Is he staying in one room, a series of rooms? What's the physical situation?
So as I just stated, he is isolated in the White House residence. Look, the president could be a president anywhere, right? It doesn't matter where he's located. He has the technology, he has the tools, what he needs, the communications, what he needs to continue to doing his job.
And has staffing here been adjusted at all? Fewer people around?
There has been no change to our protocol as of date. I think you just asked. No, I gotta go around. Your colleagues are gonna kill me. I gotta go around. Go ahead, Tam. We'll go to the back.
I just want to parse the timeline a little bit. I think there may be a comma in the doctor's statement, and I just want to clarify. Did he start experiencing the cough last night, or all of the symptoms last night? I guess my question is, when did he start experiencing fatigue? When was the first sign of fatigue?
Yeah, I mean,
spoke to the doctor.
I spoke to the doctor. I spoke to the president. My understanding is, again, his doctor spent a lot more time with him than I mean, and I haven't spent time with the president. I just spoke to him on the phone. The president felt well all day yesterday. I think late in the evening, he felt some amount of fatigue. After a long day of travel, I don't know. There are a lot of late evenings where I feel some amount of fatigue. I don't know about all of you. He went to bed. I asked him how he slept. He said he just had a bit of a restless night. And this morning got his routine tests that he does. And then when Dr. O'Connor probed him further on symptoms because he tested positive. That's when he mentioned, yeah, that maybe I was a little tired last night. So I really think his symptoms, you could say, either began late last night or early this morning.
Did he have any fatigue or runny nose or anything like that on Sunday, Monday, or Tuesday?
He felt totally normal and said that he felt, at least to me, he said he felt totally normal all day yesterday.
Has he experienced any fever or brain fog, other symptoms of COVID?
He's had no fever.
Okay, and could we get the president's physician here so that we can not play the game of telephone?
I don't think this is a game of telephone. You have Dr. Jha, who is a medical doctor himself, who runs our COVID-19 response. You're going to hear regularly to a statement from Dr. O'Connor. And so we are going to be as transparent as we are going to be transparent as we have been. We put out a statement this morning. We put out a letter from Dr. O'Connor. You have both of us here taking your questions and answering them. You saw a picture of the president, you saw a video of the president, and so we are doing this very differently, and we're going to continue to provide information for all of you and also the American public. I'm going to continue to go around. Go ahead.
Thank you so much. While doing contact tracing, will you reach out to some of the officials the president met last year while traveling abroad, or is that too far away?
Yeah, so contact tracing for people in the last 48 hours who were after he tested positive. So somebody met with the president a week ago, they would not be considered a close contact.
You won't, search for maybe people like positive with COVID that he met last week, or that.
Are we going to go looking a week ago to see who might have given? That's not. I mean, no. The purpose of contact tracing is to make sure that anybody who might have been exposed is so identified to prevent onward transmission.
Okay, Karen.
Thanks, Karine. To follow up on Steve's question, I think you had said that there was no change to protocols here. Do you mean the West Wing for change of staffing protocols?
I think that was Steve's question. Okay. I just don't have an update on that.
How about the residents, though? Is there a reduction in staff while the president's in isolation?
Well, we're going to follow CDC guidance, right? Which is for the president to isolate and to make sure there is a very, very, very minimal footprint, because our goal is to make sure that we keep others safe.
So there are limited people that will be around the president.
If anyone, to be quite honest, because we are going to follow CDC guidance.
And to follow on what you had said earlier about we'll be getting updates from Dr. O'Connor. Will that be statements every day?
There'll be statements. It'll be daily statements from. It could be directly from him. I believe it'll be directly from him, but you will get a daily statement.
A daily. Necessarily come here and do a briefing.
We're going to give daily statements, just like we provided the letter with transparency. The letter he provided to me, we made sure that you all saw, and we'll continue to make sure that you guys get an update on the president on a daily basis. Okay, go ahead.
We have been watching the press briefing at the White House, an update on the president's condition. If you've been watching, they continue to offer a upbeat, a positive assessment of the president, said to be suffering from mild symptoms, testing positive this morning as part of his regular testing routine in an antigen test positive for COVID. The president immediately put on an antiviral drug. We heard the White House COVID response coordinator, Dr. Jha, explain that the fact that the president is fully boosted with a total of 4 shots, that his risk level is dramatically lower, and even lower because of the antiviral drug that he's now been put on. Chief White House correspondent Kristen Welker joins me now. Kristen, we heard Dr. Jha refer to it. You get the impression this was felt like an inevitable situation at the White House.
Well, there's no doubt, Lester, and the White House has been trying to prepare the public for this possibility for months now, saying that the president is stepping up his travel, and so it is possible that he could contract COVID-19. And now he has, and the White House really trying to stress that his symptoms are mild, that he has a cough, some sniffles. Anyone who's ever had COVID knows that this can be a bit of a roller coaster ride. So also stressing they will continue to monitor and update update the public on a daily basis. Now, what is notable, a couple of things, Lester. One, you heard Dr. Jha use this moment to really call on people to get vaccinated and boosted if they're over the age of 50. He also stressed the importance of reaching out to your doctor, determining whether you should use Paxlovid. Not able to answer some questions, though, Lester, that were posed to the White House Press Secretary Karine Jean-Pierre and Dr. Jha. Among them, whether the president was a close contact in recent days with someone else who may have tested positive, how many close contacts has the president had, and where he may have contracted COVID. We know that the president was recently traveling in the Middle East. Yesterday, he was in Massachusetts. And when they were asked where he may have contracted it, Karine Jean-Pierre said it doesn't matter. What matters is that he is following CDC guidelines and that he has mild symptoms. But those are among the questions that I anticipate reporters will continue to ask of this White House, of this administration, as we continue to track the president. They also dealt with some of the complicated optics that we have seen evolving throughout the day. You saw the president in that video statement that you showed at the top of this broadcast, Lester, to really try to make the case that his symptoms are mild. You heard officials there getting pressed on whether or not this adhered to CDC guidelines. The fact that the president is not masked in this video. Dr. Jha saying, look, he was 6 feet away from the videographer who was masked at the time. But these are some of the data points that this administration will continue to get pressed on as we continue to track the president and his course of having COVID. Now, these officials stressing that he is still doing the business of being president, reaching out to officials, for example, in Pennsylvania. He was supposed to travel there earlier today to talk about gun violence. Of course, he wasn't able to make that trip. But the big question, he was in Massachusetts yesterday, Lester. So were some of those officials with whom he met yesterday potentially close contacts? Again, those are some of the key questions that we still need answers to, Lester.
Kristen, thank you. Let me bring on Dr. Kavita Patel, a primary care physician and NBC News medical contributor, joining us. Doctor, let me ask you about the president's age, 79. It was brought up, and Dr. Jha was careful to talk about more of his immune system, but we have been told throughout this crisis that age makes a difference in terms of a person's ability to deal with it.
Yeah, Lester, it makes a difference in how long the immunity lasts from either infection or vaccines. And it can obviously make a difference in your chances of being hospitalized or unfortunately dying. Obviously, the boosters were incredibly important in protecting against that. But a 79-year-old, no matter who that person is, we take very seriously. And the key was diagnosing it early and getting treatment to him as early as possible.
All right, let me turn to NBC News medical contributor Dr. Vin Gupta and get your thoughts on all this. The president exhibiting mild symptoms, given the getting on the antivirals right away, given the fact he's fully vaxxed, where do you see this going?
Well, Lester, as Dr. Patel just noted, I do think the risk of progression here is far lower than it would have been if the president wasn't fully vaccinated, boosted, up to date with his vaccines, and having early initiation of Paxlovid. What I suspect Dr. O'Connor to be doing in the next 6 to 8 hours into the coming days is checking oxygen levels every few hours, examining the president's just clinical status. How is he feeling from an energy standpoint? Is he lethargic more than, say, usual at the end of the day? What's his blood pressure like? If COVID will progress, Lester, we suspect maybe the blood pressure will actually be lower than it would otherwise normally be. And then critically, and for all your viewers out there who are probably wondering, well, gosh, what do I do if this happens to me? Looking at what his oxygen levels do when he's walking. We suspect the heart rate typically will go up, but so that more blood is actually going to the lungs, but that the oxygen levels actually, Lester, stay within a relatively similar range as they would when you're at rest. If that deviates, if we're seeing lower oxygen levels at rest or when the president is walking, that could herald that maybe the president actually does need to go and get an in-person evaluation at a hospital. So these are some of the things that they're going to be looking at.
Dr. Gupta, if we can just take a step back here and talk about where we are with this subvariant that is now dominant, BA5. I think a lot of us have known a lot more people getting COVID here in the last few weeks. How contagious is this? And does this change our ability to live life as we're seeing on so many levels, people attending events again, people going to crowded restaurants again?
Lester, I don't, but it's important for everybody to understand that the immune system in our respiratory tract, in our nose, our mouth, and in our lungs is different. We don't have a lot of antibodies or other immune fighting cells. We don't have as many of those in our nose and in our throat. That's why it's easy for something hyper contagious like BA.5 to set up shop, cause runny nose and sore throat as the president is experiencing, even if he's fully vaxxed, up to date with his boosters. That's not surprising. Severe pneumonia, however, is a different story. Our immune system is very strong as we go further into our lungs, so that's why he's protected. As to whether this changes how everyday Americans live their lives, listen, when I go to the grocery store, if I'm on a plane, I'm wearing a mask because even so-called mild COVID is still significant. People are laid up in bed for 5 to 7 days. Lester, I'm sure you know friends, family, perhaps, that have experienced this. It's not a walk in the park here. So I would recommend that every American, when they're out in public, especially given the uncertainty of the winter ahead, to take vigilant steps to protect themselves, because there are not going to be public mandates anymore. It's going to be to each individual to make their determination.
Dr. Vin Gupta, thank you. This has been a NBC News special report. I'll have much more on this on Nightly News this evening. For now, Lester Holt in New York. Good day, everyone.
You are watching NBC News Now. We're following breaking news at this hour. I'm Aaron Gilchrist. President Biden